There are many times when I would look in the mirror, especially, going to work in the morning and say, "Oh my God, is that my face?" Because I don't feel that old. I don't look that old. I'm a really good athlete. I cannot believe I'm 50 years old, and that's my face. That's when I started thinking about I needed to do some fillers. After treatment, the lines did virtually disappear. These were really quite smoothed out, as you can see. And this was much more upturned here. And above the lip line, it was virtually fuller and fresher and just looked more youthful. My treatment took about 45 minutes, so I was, back in my office within an hour and 20 minutes, and it was great. Before I had treatment, I would use products to help, fill in the lines and then put makeup over that. And it was just a, 10-minute process in front of the mirror, which is more time than I have in the morning. I was really excited to show all my girlfriends how great I looked, and they all loved it. And I'm sure some of them have done it and some will do it. Today, someone said to me, "God, you look so great." And I said, "I don't feel too good. I'm tired. I'm, exhausted. I have no makeup on." They said, "No, you really look beautiful. You look great. Did you do something?" And I, of course said no because I didn't want her to know. But I said, "Thank you."
The Restylane family of products includes Restylane, Restylane L, Perlane, and Perlane L. These products can be used to add volume and fullness to the skin to correct moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth, nasolabial folds. Restylane and Restylane L may also be used for lip enhancement in patients over 21 years. Ask your doctor which is right for you. Important safety considerations for the Restylane family of products. Products in the Restylane family should not be used by people with previous bad allergies, particularly to microorganisms known as gram-positive bacteria, or by people with serious allergies to drugs that have previously required in-hospital treatment. These products should not be used by people with bleeding disorders. Products should not be injected anywhere except the skin, just under the skin, Perlane and Perlane L only, or in the lips, Restylane and Restylane L only. Restylane L and Perlane L should not be used by anyone with a known allergy to lidocaine. Use at the site of skin sores, pimples, rashes, hives, cysts, or infection should be postponed until healing is complete. In these instances, product use could delay healing or make your skin problems worse. After treatment, you might have some swelling, redness, pain, bruising, or tenderness. These are typically mild in severity and normally last less than 7 days in nasolabial folds and less than 14 days in lips. Swelling may be more likely in patients under 36 years, and bruising may be more likely in patients over 35 years. Rarely, the doctor may inject into a blood vessel, which can damage the skin. Although rare, red or swollen small bumps may occur. If you have had facial cold sores before, an injection can cause an outbreak. To avoid bruising and bleeding, you should not use the products if you have recently used drugs that thin your blood or prevent clotting. Products should not be used during pregnancy, when breastfeeding, or in patients under 18 years for nasolabial folds. Treatment volume should be limited to 6.0 ml in wrinkles and folds, such as nasolabial folds, and limited to 1.5 ml per lip, Restylane and Restylane L only, as greater amounts significantly increase moderate and severe injection site reactions. The safety or effectiveness of treatment in areas other than nasolabial folds and lips, Restylane and Restylane L only, has not been established in controlled clinical studies. The Restylane family of products is available only through a licensed practitioner.